with menopause, we often see a lot of sexual dysfunction happen. As our estrogen levels go down, that good blood flow to the vagina also starts to go down. And so the vagina doesn't stretch as well. The glands don't produce the lubrication, so it's dry. And so what was once a fun thing to do is now something that you dread, right? You don't want to be sexually active. And that can become really stressful because you want to maintain that part of your lifestyle. And so seeking treatment for that is really important. And some women start seeking treatment for that before they've actually gone through menopause, because again, estrogen levels can start to decline years before you actually go through menopause and before your periods stop. So all those symptoms can start at any time, right? Like
they started. I just ignored them for a while. I was like, oh no, this isn't really happening. And when you talk about like treatments, like what are some of those for like the dryness? Like what are some of the things you all recommend?
Yeah. So we talk about a gamut of options, and obviously vaginal estrogen is like the one thing that is replacing the problem, which is a lack of estrogen. And I think there's a lot of anxiety about estrogens in general. So as much as we're worried about our hormones, we're also worried about potential cancer from using a hormone. And there have been a lot of studies that have looked at low doses of estrogen in the vagina, and we don't see those increased risks of breast cancer or uterine cancer in patients. So that's one of the first things that we offer. But for women who don't feel comfortable with hormones, or maybe we should try to avoid hormones initially, there are a lot of other over-the-counter options. You can go to Kroger, to the cooking aisle, and pick up some coconut oil and use that, and that can help just kind of naturally moisturize the vagina.
I didn't know where this was going.
Every woman you see who's looking at coconut oil, there's two potential reasons. So that's one of the great, normal natural options. There's lots of over-the-counter moisturizers like Refresh or Replens. And now, vaginal hyaluronic acid. This is like the epitome of non-hormonal vaginal moisturizers. They actually have compared vaginal hyaluronic acid to vaginal estrogen cream, and they found them to be equally effective in treating vaginal dryness. So for my patients I know estrogen cream will work in most women, but not everybody feels comfortable using that. So that is a great alternative. There's lots of options sold online, lots of different brands, and it works pretty much just as well.